Restylane or fractional laser? Or worse, do I need blepharoplasty? Hi, I'm 35 and I'm very unhappy about the area under my eyes. When I'm not smiling, I look tired with big bags under my eyes. And when I'm smiling, I get both wrinkles and excess skin pushing up toward my eyes. I've looked into both Restylane and fractional laser. Would either of these help, or both? Or do I need full-on blepharoplasty? Thank you so much for your help, Emma.
Thank you for your question. I can't help be a little bit amused by the style of your question. You asked about Restylane laser and at the final end of the question, or worse, blepharoplasty. Well, what your question helps to illustrate is the complexity of understanding how to manage changes that affect the lower eyelids. You see, everything you described is basically something that comes to our practice every day and is what we spend a lot of our days evaluating and strategizing about. So let's break it down and understand what your issues are. First of all, when your eyes are at rest, and you did a really nice job of showing the pictures of your eyes at rest, and then your eyes when you smile. When your eyes are at rest, there is clearly volume or puffiness. And so the question is, what is the puffiness and what do you do about it? Well, the puffiness is basically something called lower eyelid fat prolapse. Lower eyelid fat prolapse means that the fat that's normally around your eyelids pushes forward and creates a bulge, creating this puffiness. Now, interestingly, until recently, people mostly would first consider lower eyelid blepharoplasty as a procedure after they had tried all of their homemade, or should I say over-the-counter remedies, none of which work, because the fat pocket has prolapsed, it's pushed forward like a hernia. So a few years ago, some discussions in the medical literature revealed the opportunity to help camouflage the appearance of lower eyelid puffiness with hyaluronic acid such as Restylane. Unfortunately, that led to this proliferation of a myth and a belief amongst non-surgical physicians. And when I say that, I mean very often physicians who were in non-surgical specialties such as internal medicine or pediatrics, who decided that they wanted to do aesthetics. And they decided that amongst themselves and in their conferences that doing injections under the eyes to reduce puffiness is the ideal solution. And of course, to the man with the hammer, the world is a great big nail. That did not work out very well for a lot of people. In our practice, we know that there's a threshold. If you only have a small amount of fat prolapse, then we can very often strategically place a little bit of Restylane just in the area called the tear trough and soften that transition and buy some time before you're ready for a more definitive procedure. Now, the definitive procedure for you would be cosmetic lower eyelid blepharoplasty. Now, understanding so many of the concerns that people have about the risks of surgery, I spent the past 20 years developing a process such that lower eyelid blepharoplasty is as minimally traumatic as possible. And what I do is I do the procedure under local anesthesia with light IV sedation. And what that means is like local anesthesia, that is like getting a little pinch of anesthetic, and then getting IV sedation, which means getting something like liquid Valium in your intravenous, and you're relaxed. For a lot of our patients with this appearance, I'll do the procedure from the inside, otherwise called a transconjunctival blepharoplasty. That means there's no external sign that there is any type of incision or surgery. Now then most people raise the point that what do I do about these wrinkles? And when they smile, like yourself, you perceive that there is excess skin. But excess skin, by definition, should not be what skin is recruited when you push the cheeks upward, but rather what skin is there when the face is at rest. A lot of plastic surgeons have gotten themselves into trouble because they've taken out skin with the desire to improve wrinkles, and the eyelids got pulled down. So this brings us to the next part, which is skin quality and the muscle activity. So with muscle activity, you have probably heard of drugs like Botox or Dysport, and these are drugs that are injected to reduce the activity of a muscle called the orbicularis oculi muscle. When that muscle contracts, the wrinkles become deeper. And this term is often referred to as dynamic wrinkles. Now the opposite, or I should say the other kind of wrinkles we talk about are called static wrinkles. Now static wrinkles have to do with skin quality and the loss of collagen that causes the skin to thin. The lower eyelid skin is the thinnest skin in the body, so in situations like yours, I would do a combination of platelet-rich plasma, which is derived from your own blood and is the section of your blood, or the part of your blood that is concentrated, that has the platelets, the healing factors. And we'd combine that with fractional CO2 laser. What that does is basically we're trying to build up collagen, and with platelet-rich plasma, we actually are able to improve the vascularity or the blood supply to the skin, and such that the skin quality improves. So a typical strategy for a person like yourself would be transconjunctival blepharoplasty with fractional CO2 laser and platelet-rich plasma, and then as an ongoing maintenance procedure or some way to minimize the activity of the muscles that cause the lines to form, we would be doing Botox or Dysport. So I think what you need to do is, of course, discuss this with a highly experienced cosmetic surgeon who is not limited. And that's why I leaned you towards a surgeon. Unlike the myth that is often believed, is that surgeons are not knife happy, at least a lot aren't, and you can actually hopefully look for someone who can understand where you're coming from and what your concerns are, and see if you click. So once you meet with someone who actually has the capability of doing all these procedures, then bias and limitations are less likely a factor in the recommendations. So I hope that was helpful for you. I wish you the best of luck. Thank you for your question.